Thank you so much, Esron Karimuribo from Southern African Center for Infectious Disease Surveillance, SACIDS. Share with you today an accelerating One Health disease surveillance in East and Central Africa. And this is a work which we started longer time ago. It started actually way back 2013 when I was in Cambodia. We got this idea of EpiHack, which enabled us to catalyze and organize the first EpiHack in Tanzania with actually key information that were generated to give direction of how the AfyaData should look like. So in a nutshell, what we came out is the importance of engaging communities in designing and also supporting the surveillance system in data collection. So during the EpiHack 2014, we actually identified major 4 issues that were actually informing the design and actually acceleration of the AfyaData application. By the way, the AfyaData means is a Swahili English combination, Afya for health and data for data. So the branding by itself was actually participatory. So from that participatory exercise, it was clear that in order to engage the community, it's very important you do it right from the beginning, not bring them at the end. Therefore, we have actually an experience of working with the community using the participatory approaches, and therefore the concept of developing the app. I hope the slides are moving. Yeah, so actually we have 3 important approaches we use. First of all, use the EpiHack, which is convening of health experts, both animal and human, together with the technology tech developers, but also, as I mentioned later on, engage community. And therefore, the 4 actually identified challenges was, first of all, the official data was not actually arriving in real time. Community-based surveillance was a problem, contact tracing, and we needed a 2-way communication like what we learned yesterday. So this informed the design of AfyaData. And right from the beginning, we were conscious of One Health, so we designed actually system for collecting human diseases, animal disease, and both. But there are core attributes, which includes ability to the app to be actually open source and be able to capture the geographical location, include the multilingual ability to collect data from different communities. And therefore, we have worked in different areas. The first one, the first map on your left actually indicates where we're using the feature, the smartphone, and then the right one where we use the feature phone, exploiting USSD technologies, collecting information from different geographical region within Tanzania. I will extend actually the concept is to also collect information from cross-border ecosystem, which is very important also to share information between countries. So when it comes to assessment for how actually the app performs, this was measured in timeless, from time to detection and also time to response. You could see significant actually reduction for time to detection from 10 to 2 days. But also we extended the use of AfyaData through a cholera support model, whereby actually the team involved in cholera could actually easily use AfyaData to monitor actually cases and also the lab so that the barcoded sample could send information back to. Then the concept of cross-border, this one border we share between Tanzania and Kenya. So one wonders, you see the beacon, me and Eric, it's only imaginary border separation between cross-border communities. The animals were grazing in no man's land, and therefore you wonder where do the animal belong. So we have actually been able to characterize high-risk ecosystems in neighboring countries with Kenya, Uganda, Zambia, and Malawi, and also the Mozambique. And this has been very instrumental in promoting cross-sharing of data. At least we have tested this concept in 3 ecosystems in Ngorongoro, in Kagera River Basin ecosystem, and also the sharing border between Tanzania and Burundi. And therefore, the concept of cross-border sharing of information does not actually necessarily need to have it. And this actually extended to use of AfyaData during COVID-19, where first of all, we had to use the same version, but upgrade it to Afya Msafiri, supporting port health surveillance at the airport and other ground crossing, but also we made some actually support in neighboring country of Mozambique, where we trainers to be able to actually support these active cases reported from the community level. And now from this concept of we being able to be recognized. Last year, actually, we were actually visited by a filming crew from Bill Gates in the what we call the field, actually the heroes in the field, and this is available on YouTube with a detailed documentation on what was. And what we're proposing now is the way forward. First of all, we need to use the mobile app, but support with actually, because the mobile app will capture air information, but point of care diagnostics, now we have available gadgets which could support them. And the last one is actually linking the community data to the national health. We currently actually developing another actually platform of supporting sharing of information, early information from the community between different health sectors, the public health, the animal health, and the environment. But also because actually the information is reported from the community, we have included an ability, this Afya crowdsourcing, triaging, and verification. And therefore, that is us. We really thank different supporters. You know, we started with Rockefeller, IDRC, School Foundation, School of Threat, and Ending Pandemics. We really appreciate that support that have enabled us to do what we need. Thank you so much.